It is Indiana in the morning. It's WCCS 101.1 FM, AM 1160, WCCSradio.com. And we're so happy to have Dr. Nazneen Billimoria in the studio with us, the Comprehensive Breast Center at the Indiana Regional Medical Center. October is Breast Cancer Awareness Month, and so we have a special focus on this disease in which we're making so much progress. Our visit presented today by Marcus and Mack, voted best law firm and best personal injury lawyer 3 years in a row in the Best of Indiana County contest. Visit them online at marcusandmack.com. Good morning.
Good morning, Todd. Thank you for having me.
Well, we get you in here every year to talk about breast cancer and the very, very many ways to treat it now, and those are expanding. The ways to detect it and diagnose it also, they're getting better too, aren't they?
Oh, yes, they are, Todd. And, 3D mammography has been out for some time now. And that is typically our first screening tool for any woman, age 40 and older. That's the screening age that it should start for a person at what we call average risk. So that's a person without any family history of breast cancer or anything. And it's night and day difference between what we can detect with the 3D mammography compared to the 2D mammography, which is what we had in the past. Mm-hmm. So that's one of the advances. Of course, breast ultrasound has been out for quite some time. And that is always an excellent adjunct to mammography, but it does not replace doing your screening mammogram to begin with. And of course, the ultrasound machines have gotten so much better over the years as well. And then finally, of course, we have breast MRIs, which is just a different way of looking at the breast tissue compared to mammograms and ultrasound. And so when women have dense breast tissue, the MRI really does add additional information that can help us detect breast cancers, should they need it.
And typically that's going to be a younger woman?
Yeah, it is common for younger women to have dense breast tissue. In fact, I'm glad you mentioned that, Todd, because in women under 30, we don't even recommend doing any mammograms because the breast tissue is so dense, you're not going to really see anything. Mm-hmm. So for really women who are high-risk screening, who have an extensive family history, the recommendation for early screening is to start with a screening breast MRI at age 25. Now, for other women, if they've had first-degree family members, their screening starts 10 years before the youngest family member, but mammograms not before 30, just because they don't do anything for us.
Yeah. Now, those are great diagnostic tests, but should women also be doing self-exams between those tests? If you're having it done annually, should you also be on a monthly basis or a weekly? Well, I don't know what the recommendation is.
Yeah, that's a great question. Previously we used to suggest women do self-breast exams. Nowadays we've moved away a little bit from that. Of course, women who are used to doing self-breast exams, go ahead and do it, but you want to do it at the same time every month. So basically the same time during your monthly cycle. Mm-hmm. Women who are not used to doing self-breast exams, we don't necessarily recommend starting because the breast tissue is very lumpy bumpy. It's not all smooth. So a woman who is not used to doing self-breast exams is going to feel all these little lumps and bumps in the breast, which are most likely normal, but it provokes a little anxiety because they're wondering, is this a lump? Is this a lump? We don't know. So then it prompts, coming to the doctor and then sometimes having to do tests that may not necessarily be warranted. Mm-hmm. So I tell women, if you're used to examining your breasts, go ahead and continue doing it. You just want to do it at about the same time every month during your cycle. The shower is a good place to do it, just because it's easier to feel things. And if you're not used to doing it, the recommendation is your annual mammogram and then a clinical breast exam by either your family doctor or your gynecologist.
All right. So there you go. And now we're talking about detection. And a part of that whole discussion has to be with finding any problems early. The earlier you find it, the better off you're going to be in terms of treating it, correct?
Oh, absolutely. And that's why we recommend mammograms, because the small little breast cancers that we are seeing on mammogram, you're never going to feel that on a self-breast exam or even on a clinical breast exam by a physician, because they're so small. And sometimes they just appear as little calcifications. There's no way you're going to feel that. The only way you're going to feel that is if you let it go, and over time it grows in size, and then ultimately it does become a mass that you can feel in your breast. That being said, for women who do self-breast exams, things to watch out for. Any hard lump in the breast that feels different to the rest of your breast tissue. So if you imagine putting a rock or pebble under the skin, how that would feel extremely hard and different to the rest of your breast, that is abnormal. You need to see someone about that. Any change to the appearance of your breast, any puckering or dimpling of the skin, any change to the appearance of the nipple, whether it's retracted, inverted, and it's not normally like that, that needs to be evaluated. Any change in your breast size, one breast becoming dramatically larger than the other, that is not normal. You need to see someone. So those are things that women can look out for just, on a day-to-day basis.
IRMC will be holding something called a Mammoglam on Monday, October 21st from 4 to 6 p.m. at the Women's Imaging Center. And the Breast Center team is going to be there. Are you going to be a part of that?
Oh, absolutely, Todd.
Yeah.
Yep, I'm going to be there. Dr. Dan Clark, my surgeon colleague, is going to be there. And also Dr. Margaret Clark, our breast radiologist, will be there. And we're looking forward to seeing women in the community come out and, answer any questions that they might have.
One of the big parts of that is the fact that you get the sense when you attend an event like that it really is a team approach at IRMC when it comes to breast cancer.
I can't stress that enough. Breast cancer treatment involves a combination of doing surgery, chemotherapy, radiation. It's not just one field. So, it's myself and Dr. Clark with the surgery. Of course, it all starts with detection. So radiology, Dr. Margaret Clark, and then, of course, our other radiologists as well. And then it goes on to any adjunctive treatments after surgery, such as chemotherapy, and then also endocrine treatments and things. And that's done by our fabulous oncologists, Dr. Ramanini, Dr. Mukamala, both of UPMC because of our affiliation with the Hillman Cancer Center. Mm-hmm. And then after that, it's radiation. And that's Dr. Chitty, who is also part of the Hillman Cancer Center. And, I think we're a great team. And then in addition to that, it's all the nurses and the technicians and the, people in the operating rooms. So it's a huge team. People only get to see a few of us as the faces, but there's a lot more behind us to just us.
Typically, we concern ourselves with women, although men do get breast cancer. So there is a risk for men as well. But typically, it's women that we are most concerned with when it comes to breast cancer awareness and treatment. It is a devastating diagnosis, and I certainly can't address it, but you have been in contact with so many patients down through the years who, when they get that diagnosis, probably feel as if they've been run over by a train.
Yeah.
Restoring that hope to them has to be really, really important.
It is. It's, it's why we do what we do. It is, a lot of times, most of these breast cancers that we diagnose nowadays are stage 1 breast cancers. We typically are curing women of stage 1 breast cancer. And although the diagnosis is shocking and, their first response, it can't be me, this can't be happening to me. But I try to tell them, this is a little bump in your journey and we're going to get you over this bump and you're going to move on. And I think our support staff at IRMC for the women is also excellent.
Yeah, that catching it in stage 1 is such an important part of that treatment protocol because you have so many more options and so many more ways to approach it and attack the cancer. Because you really have to go on the offensive against it, don't you?
Yes, you really do. Yeah, absolutely. I mean, a stage 1 breast cancer basically means it's a breast cancer that's very small. Most likely has not gone to any of the lymph nodes in the armpit. And so typically we're just treating that with what we call a lumpectomy, which is where we just remove a lump of tissue from the breast containing the cancer. And then after we do that, based on the age of the woman, the type of cancer, whether it's an aggressive form or not aggressive form, they may require chemotherapy. And if they don't, then they go on to have radiation. So it is a very treatable entity if we catch it early. And like I say, most women with stage 1 breast cancer, we're curing them.
She's Dr. Nazneen Billimoria with us here this morning. The event on Monday, October 21st, is from 4 to 6 p.m. It's at the Women's Imaging Center at the Indiana Regional Medical Center. All kinds of wonderful things will be happening that day. You can get yourself a mocktail, a non-alcoholic drink. Appetizers will be served. There's a chair massage. It's all designed to make you feel comfortable with something that can be a very uncomfortable topic. And you'll meet the Comprehensive Breast Center team. You may RSVP. There is a QR code at irmc.org/2024, or you can call 724-357-7188. And even if you're not due or eligible for a mammogram, I know, Nazneen, that you would love to have people come out anyway and bring a friend who might not have had their mammogram ever. I mean, there are women out there who just try to skate through and never get it done.
Yep, I couldn't agree more, Todd. I mean, some women are just, well, I have no family history and, you know, I don't feel anything, and I just, you know, it's almost like they just don't want to know. But to all the women out there, if we catch this early, it is curable. It is certainly worth coming in every year. You know, October is my birthday month, so that's the month that I get my mammogram, so I'll be going next week. Mondays are walk-in Mondays for mammograms at IRMC, so, you know, if you can't schedule an appointment, walk in on Monday, and we can certainly get it done then. Really, ladies, there's no excuse, because if we catch it early, we can cure it.
There you go. Very well said. Thank you, Nazneen. We appreciate it.
Thank you, Todd.
Dr. Nazneen Billimoria with us here this morning. It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. Boomer Sports coming up next at 8:25. And then Jake is here from the WCCS newsroom. We take a look at sports right after that. And then in our 8:45 segment this morning, Lisa Spencer from the Indiana County Department of Human Services. It's Indiana in the Morning. It's WCCS.